Cities throughout the country are trying to make headway against the opioid crisis. As always, the key is to provide effective treatment with more access for people who need help. That's the reason for the renovation and expansion of inpatient detox services at the Dimock Center in Roxbury. To tell us about the services is the Dimock Center's president and CEO, Dr. Myechia Jordan. Thank you very much for being with us.
Thank you for having me.
First of all, tell me about the building, because this is a piece of history you're working with here.
Sure. So our entire campus is historic in nature. It's a nationally designated historic site, and the building is one of our historic buildings built back in the 1800s, and it initially served as the maternity ward for the New England Hospital for Women and Children. So it's really wonderful that we now have transitioned it to our detox unit, and I think of it sort of as a cycle of life. There were so many people that I meet that were born there, and now we have people that are being reborn in many ways as they are on their road to recovery.
How does having the kind of space that you have now make a difference with treatment?
So we know that the opioid epidemic has far outpassed or surpassed the number of treatment beds that are available both within the city and state. And so with the renovation, we were also able to expand and increase our capacity to serve more people. So we'll go from being able to serve 3,000 people a year to over 4,000 people a year with the expansion. And so I'm really proud of that fact that we now have better access for people to really seek the treatment that they need.
Well, of course, you've got places where people stay, you've got rooms where they maybe meet with counselors, and looking out the windows in there, it's a nice environment, actually.
It's a beautiful environment, and I think there's a lot of competition and jealousy on our campus now because I think it's probably one of the most beautiful buildings on the campus. But most importantly, it's an opportunity for us to have an environment that's respectful to our clients and to our patients, and a place where our employees can interact with our patients and really help them to design their care management plan, the plans, and once they leave our detox, what happens to them then. And so what we did was we took a lot of time designing the unit to ensure that the care managers were embedded in the unit with close proximity to our patients. The nurses had close proximity to the patients so that we can make sure that they're getting all the help that they need while they're with us.
Well, I guess the main reason for expansion is that there must be a backlog of people who need this kind of help.
There is. There are wait lists all across the city and state. And what we found, particularly in Boston, is because there's such a shortage of beds, we have people coming from outside of Boston seeking treatment within Boston. So our goal is to make sure that we're providing access to all, but most importantly, access to the community in which Dimock resides.
Well, when I look at the numbers and I see how many people will be added in the course of a year, and I divide that and I come up with, well, maybe they get about a few days there?
So anywhere from 10 to 14 days. Thankfully, there was new legislation passed, recent legislation passed to help prolong the amount of time that people could be in recovery, which we know that they need. And so the 10 to 14 days allows the physical addiction to pass, but there's so much more that needs to happen within that time frame, establishing what happens after detox, connecting people into behavioral health care to begin to address all the issues that cause the addiction in the first place.
And I imagine when you get someone who's at this stage, you know, it's not just drug dependency that's an issue. You might have overlaps with other things. There could be, earlier trauma. There could be mental illness.
Of course. So behavioral health is an important aspect of what we provide while people seek care within our detox, and it's just the beginning of their care. We're fortunate to have the full continuum on our campus, so after a detox program, they can move into one of the 3 residential programs we have and/or outpatient addiction services.
This is BNN News, and we're talking with Dr. Myechia Jordan from the Dimock Center. Doctor, I want to go over how this got done as quickly as it did, because, this isn't just like the state threw a bag of money and it happened.
No, not at all. I think part of how it happened, and this was when I became president now 5 years ago, we knew from our predecessor, Ruth Ellen Fitch, that the building had structural issues, and we knew that eventually it would have to close. That, coupled with the attention, rightfully so, on the growing opioid epidemic by then Governor Patrick, as well as other supporters, primarily the Myechia Foundation, really was what helped catalyze the capital campaign. The Myechia Foundation had been with us from the very beginning and had actually supported our use of structural engineers to determine what the building actually needed. They then were helpful in helping us to create a capital campaign by the use of consultants, understanding how far could we go with this. We then knew that we could seek new market tax credits combined with state historic tax credits. So we began to walk through all of those processes. Governor Patrick and the administration at that time did an appropriation for us. We were able to leverage that to get new market tax credits. And then our donors, corporate supporters, the Myechia Foundation being the lead, all three hospitals, which I think is really important, Beth Israel Deaconess, Parton's Healthcare, Boston Medical Center, all stepped up to contribute to the campaign. I don't know of any other venture that all three hospitals within these different networks came together to support a cause for. So we were really fortunate that everyone understood the urgency around this issue and everyone stepped up to support our campaign.
Well, the Yawkey Foundation was very generous with this particular project, but
Yes.
but you know, they have other people looking for their support too. So
They do.
were you worried about that going in there, making the pitch for this?
I was certainly worried, but I think part of what I credit the Yawkey Foundation with is being able to take on these tough issues and very early on, before it became what it is today in terms of the news and being the headline of the news. They recognized this as an issue and were very supportive from the very beginning and allowed us to leverage their name in attracting other donors and other supporters. So I think it was that combined with the legislators were key. Senator Warren and her support for this issue, Representative Myechia, Representative Sanchez, all were working at the state level as well to help really push along the funding that we were able to garner.
The opioid crisis is at least a national problem, if not more than that. But,
Yes.
but what about the advantage to the local community having an agency like yours that's dealing with it?
I think the advantage in many ways is we now know that the opioid epidemic is represented by many, many different ethnicities. There's no sort of social demographic that is immune from this issue. And the advantage of Dimock being at the forefront of this is that we don't forget about people within the community, Black and brown faces that are also part of this epidemic. Quite often now we see that there's been a shift in the faces that are represented. And it's important for us to remain at the forefront of this to make sure that our community isn't left behind as more resources are being poured into the issue. It's an issue that affects everyone. Unfortunately, it wasn't thought of and decriminalized in the way that it is now when it came to Black and brown communities. So it's important for us to stay in the conversation and really leading the efforts around bringing resources to all communities.
Thank you very much for being with us.
Thank you for having me.
Dr. Myechia, Minter Jordan.